Senator Collins.
Thank you, Madam Chairman. Secretary Cordona, I think all of us can agree that students suffer when they're not in school. And in order to avoid another year of learning loss, emotional turmoil, and behavioral problems, some school districts are implementing a test-to-stay approach. And what they do is they allow asymptomatic students who test negative for the virus to stay in school rather than quarantining them after another student or a staff member has tested positive for the virus. A recent study in The Lancet suggests that the test-to-stay approach can be safe. There was a randomized trial that included more than 150 schools in Britain that found that case rates were not significantly higher at schools that allowed close contacts of infected students or staff members to remain in class with daily testing than those that required at-home quarantine. So if our goal is to keep schools open, it seems to me that we should be looking at the science. Yet, despite this evidence, the CDC has said that at this time, they do not recommend or endorse a test-to-stay program, even though the consequences are that thousands of students in this country are once again not in school because of quarantining. So my question to you is, do you agree with the CDC or do you agree with the Lancet study and those school districts that are using a stay in school and testing method?
Thank you, Senator, for the question and for communicating the importance of in-person learning. That's the best way we can get the students the support that they need after this year and a half. And I recognize that there is emerging data or studies around this test to stay. To be very frank, since the beginning of the pandemic, we've worked closely and listened to the science of CDC, and it's helped us safely reopen schools. So we're going to continue to work with the CDC, and as their guidance changes, we'll implement at the school. But we are going to rely on our health experts who have guided us to the point where we're reopening schools across the country for all students.
Well, the problem is that the guidance from our health experts over the past year has been conflicting and inconsistent. And that heightens the distrust in these institutions at the time when the public needs to be able to rely upon them. And I think the latest example of this confusing, conflicting advice has to do with the booster shots. And that will lead me to my next and final question for Secretary Becerra. At FDA, the longtime director of the Office of Vaccines Research and Review and her deputy are leaving this fall, in part because of the decision-making over boosters. This weekend, the CDC director commented and conceded the confusion in messaging around who should receive the booster. And this was after she overruled the recommendation of her own advisory committee. Two public health experts from Brown and Harvard wrote in the New York Times that the new federal recommendations go, quote, well beyond the data. So how can HHS better ensure that public health agencies in this country at the federal level truly are following the science and produce a consistent, reliable message?
Senator, thank you for the question.
Let me put it this way. COVID does not run a linear course. And as we've seen now with Delta especially, it is wily. It can dodge, it can get around, and it can be strong and fast. And we have to try to keep pace. We have to wait for the science to give us the direction on where to go, where to turn. And I go back to what was said earlier, we have to use our common sense. I believe that Director Walensky used the science and common sense to decide how best to make sure we keep Americans safe with regard to boosts in her latest action. And I think FDA has done a tremendous job with the science that is also evolving with the variant to make sure that we keep Americans safe. The evidence is in. If you've been vaccinated, chances are you're not going to die. You're probably not going to be hospitalized. If you're unvaccinated, in fact, 99% of people dying today are unvaccinated. And so I think between FDA, CDC, all of our different agencies, NIH and others, we've done the best we can using the science to guide us and staying within the framework of the law.
Thank you.
Thank you. Senator Hickenlooper.